everyone, my name is Joanna Garcia. I'm here today to discuss about eating disorders. I will be discussing the different types of eating disorders, how they are caused, and how you can prevent or even treat them. I'd first like to start off with a picture. Now, we all have different attitudes and feelings toward this. However, it is one of humanity's necessities for existence. Too much of it, or even too little, can lead to the world's biggest health problem, which are eating disorders. Eating disorders are serious, life-threatening illnesses that can affect millions of people, and without knowing, you or someone you know can be suffering from them. So it is important to stay informed so you can prevent or even help treat them. I'd first like to start off with what an eating disorder is and what different types there are. According to Dr. Eric Johnson Sabine, a consultant psychiatrist at St. Anne's Hospital, eating disorders are abnormal attitudes toward food that leads to abnormal eating habits and behaviors. Dr. Johnson also says that there are three main types of eating disorders. The first is anorexia bulimia. Anorexia bulimia is when a person purposely avoids food intake. This then leads to a weight that is clearly too low and unhealthy for the person. Second, we have bulimia nervosa. This is when a person binge eats, meaning they will eat large amounts of food in a short period of time. This is then followed by methods like purging to get rid of excess calories in an unhealthy way. Lastly, an eating disorder that is often overlooked is binge eating. This happens when a person has frequent episodes of consuming large amounts of food in a short period of time. The only difference it has with anorexia is that it's not followed by methods to prevent weight gain. Instead, a person will just feel ashamed and guilty afterwards for eating. These abnormal eating habits must be caused by something, but what is it? There's no definite answer to this, but experts at the American Psychological Association say it's a combination of factors. The most intense of these factors might be the media. The media is a constant, overwhelming force that gives people the idea of a perfect body. People are then more likely to be aware of their weight and discontent in their own skin. After 40 years of treating eating disorders, Dr. Craig Johnson, director of the Denver Eating Recovery Center, has provided some feedback on the subject. Dr. Johnson says that eating disorders also have to do with genetics and are highly hereditable. If a person is genetically prone to eating disorders, dieting and exercise might become gateway behaviors, as Dr. Johnson mentioned. On the other hand, psychology also plays a large role in the causes of eating disorders. States of depression or loneliness can affect people by creating abnormal eating patterns. Also, if a person has low self-esteem, they may be extremely preoccupied with having a thin body. Now I'd like to talk about how one can prevent or even treat eating disorders. Being aware about the positive prevention efforts and treatments for eating disorders help a person by avoiding mistaken attitudes towards food and even help reduce eating disorders worldwide. Prevention efforts may involve reducing negative risk factors and increasing positive risk factors. This can include replacing body shaming with a more appreciative form of one's body. Also, instead of dieting, a person can learn to distinguish between physical and emotional feelings and become an expert on their own body and know when the right time to eat is. People with eating disorders should always seek professional help. Reaching out for help and admitting that you have an eating disorder is the first step in one's recovery. Talking with close friends and relatives is always helpful and comforting because they can help find an eating disorder specialist who will be able to develop a treatment plan that fits your individual needs. Now let's summarize what we just discussed. Eating disorders are serious illnesses that can happen due to either a lack of food or excessive food intake. There are many causes for this, so it's important to know when to seek help and how to prevent eating disorders, because the effect can be one of painful suffering. It's better to prevent something than to cure it. So remember to never take any eating disorders lightly. Always try to have a healthy lifestyle, and last but not least, be happy with yourself. So is there any questions?
How long does it take to fully recover from eating disorders?
So recovery time depends on the person, so it's difficult to generalize when the time scale is. So a person, it has factors that include how long the person has been having the eating disorders or what type of treatment they're getting for the eating disorders. So it usually depends on the person. Any more questions?
Yes, can males develop eating disorders?
Yes, males can develop abnormal eating patterns. It's the same illness, even if it appears as a male or a female. So in men, it usually appears in athletes or even in men who participate in entertainment industries. They follow the same problems as women. They can either feel out of control, or some of them might even be depressed or feel alienated, which can then lead to eating disorders. So thank you everyone, and that's it for today.